Yeah.
I'm going to make you talk
I
just so
know,
you can listen to your
please.
laryngitis.
I know. It's much better than it was last week, so this is on the upswing.
Dr. Drimoussis, thank you so much for coming, and tell us a little bit about yourself.
Yeah, thank you for inviting me. Originally from Greece, been in Southwest Florida since 1998, practicing in Fort Myers. 2-3 years ago, I had to go overseas for some personal reasons, and about a few months ago, we decided to come back around the Fort Myers area. What else? A reference to my education. What can I tell you? I was trained up in New York. I did my fellowship in endocrinology and metabolism in New York as well. Right after the fellowship in '98, being sick and tired of cold weather and snow and everything, and everything else, we decided to move down to Florida. And here we are.
Kind of explain to us, if you would, what an endocrinologist is.
An endocrinologist is someone that is dealing with human hormones. Is a subspecialty of internal medicine. The typical visits for an endocrinologist, somebody with diabetes or thyroid disease. 60-70% of the patient's visits related to diabetes, about 20% thyroid, and the rest 10% or so, or 20%, related to female and male hormones, adrenal, pituitary disorders, as well as obesity.
Okay. And so how does that differ from a primary care physician?
A primary care physician is someone that is dealing with multiple and general human issues. He is the first physician that usually a patient sees. He's a gatekeeper of our healthcare system, and again, is someone that is dealing with multiple problems. When the physician thinks that the patient will need more subspecialty care, then he refers to all different specialties, depends what the patient has, of course.
We're referring to diabetes.
In my case, diabetes, hormone disorders, so forth.
So, and we see here that November wasn't aware of this last month,
I
but
know.
we just missed it. But
Exactly.
November was Diabetes Awareness Month, and what's the best advice that you can give to a diabetic patient?
It's not only one advice, it's a set of advices. Primary is the diet. You see, the problem with diabetes is 80% of the success of the treatment is related to the dietary habits of the patient. So my major advice to be compliant with a low carbohydrate diet. They can be a little bit proactive and sort of look or either on the internet or through different magazines about different low carbohydrate diets. Stick with the diet. Another advice that I will give in a diabetic patient is to check the sugars. By checking the sugars, we see if the response to treatment is appropriate, and also by checking sugars, it helps us to help them to control the disease. And in addition, exercise is a very important part of the whole diabetes disorder. I would suggest them to exercise daily, about 20 to 25 minutes a day.
Why did you choose endocrinology?
Well, it goes back. I assume in the second year of medical schools, I was always impressed about the actions of hormones. Hormones are small and large chemicals that they have effects in multiple tissues in our body. Pretty much can affect from the brain all the way down to our feet. So since then, I wanted to practice endocrinology. So after I finished the medical schools, I went up in New York and I did my internal medicine training. Subsequently, I did a fellowship in endocrinology. I always liked the endocrine field.
And is it hard? You're speaking about exercise and diabetes. Do you find it statistically, of all the patients you've dealt with over the years, is it hard to get them to exercise?
Well, a typical diabetic patient, and I had a chance to practice overseas in Europe as well, it has common characteristics. So it's not something that our American population has. We see it in Europe, we see it all over the world. And pretty much we're talking about patients that they have a tendency to gain some weight or they're obese. And number two, they don't like to exercise that much. So exercise was always a problem with diabetics, and is one of the most essential things that you can do to control the disease. Usually diabetics do not like, I repeat again, do not like to exercise. We have quite a few patients though that once we diagnose them with the disease, understanding the severity of the disorder, they start exercising on a daily basis.
Some you can wake up.
Correct, you know.
And what's the difference between pre-diabetic and diabetic?
Yeah, pre-diabetes in endocrinology we'll call it dysmetabolic syndrome. Is stage 0 of diabetes, we can call them stage 0, is very early stages of diabetes. Usually they have a very striking body image, these pre-diabetics. They have a tendency for central obesity. With other words, their fat is distributed mainly around the belly. Their hands, arms rather, and feet, they're disproportional thin compared to the rest of the body. Again, as mentioned before, they don't like to exercise. They like a little bit of food and good wine or everything in between.
Not enough moderation.
Yes. Theoretically, they have a tendency, the pre-diabetics, to increase their insulin. Insulin pretty much is the hormone that brings the sugar down. It comes out of the pancreas. So the first stages of diabetes is as the pancreas senses that this particular patient has a tendency to run sugars a little bit high, increases its secretion to compensate for these high tendency sugars. So as the pancreas decompensates, loses its ability to secrete insulin, then the insulin levels go down. By doing that, we have an increase of the glucose levels, diabetes with other words. So pre-diabetes consists of high insulin levels with or without normal glucose levels, central obesity, body distribution of the fat around the belly and so forth.
And what's the difference? We hear a lot about type 2, but what's the difference between type 1 and type 2? Like, you don't hear much about type 1.
Well, type 1 diabetic, type 1 diabetes is an obsolete deficiency of insulin, and the key word here is obsolete. There's no secretion of insulin out of these patients. Usually type 1 diabetics, they're young, kids, children, thin, and relatively easier to go into major problems and complications with the diabetes. Their primary and only treatment in type 1 diabetes is insulin. From the other side, the type 2 diabetic is someone usually older in age, after the age of 30. Let's say even lately we see young patients presented and behaving as type 2 diabetics. Instead of being thin, it's a little bit obese. Again, the central obesity that we're talking about. And in reference to treatment, initially we have the option of starting medications and in later stage insulin. And again, we're talking about a partial insulin deficiency in type 2 diabetes compared to obsolete deficiency in type 1 diabetes.
Now the obsolete, are those the people that, because I had some friends who had it pretty bad, they had to wear a belt with them with like a little battery
Insulin
pack.
pump.
Yeah.
Yeah, on insulin pump. Usually
That would be a type 1 diabetic?
Yes, type 1. Someone that needs insulin to compensate for the high sugars. When a type 2 diabetic, especially in the early stages, can compensate with diet, weight loss, and PO medications, pills. Then in type 2 diabetics, as the disease progresses and eventually they lose all the secretion of insulin from the pancreas, they end up on insulin as well.
Wow. Can patients prevent type 2? I would imagine that since we've seen such a rise in it, that probably could be prevented in a lot of cases.
Well, most of the cases, in type 2 diabetes, environmental factors are very important. And what we're talking about is diet, exercise habits, and so forth, a tendency not to take care of themselves. Of course, in type 2 diabetics, we have a genetic predisposition. We know that kids or families that both parents they have older age diabetes, type 2 diabetes, they develop the disease as well. But the majority of them, they can control the environmental factors by exercising and be compliant with low carbohydrate diet. The small percent that is genetically predisposed for the disease, I'm not sure how much they can do.
Some people are just, yeah.
Correct is to develop it genetically.
All right. We're talking with Dr. Drimoussis from Millennium Physician Group on News Radio 1580 WCCF. We got to take a quick break and we'll be right back.